for attending our virtual symposium. My presentation will be on sulphadoxine-pyrimethamine plus artemisinin-based combination therapy as intermittent preventative treatment for the prevention of malaria infection and adverse pregnancy outcomes, or we call it SAPOT trial. Pregnant women are considered high risk, and pregnant women with malaria infection tend to have long-term impacts, and this could be on mom, baby, or both. Plasmodium falciparum and Plasmodium vivax are common infections in our settings. Most pregnant women tend to be asymptomatic and with no proper point of care test. These infections are tested at a later stage and may have detrimental effects to both mom and baby. Plasmodium falciparum has a sticky nature and tends to attach itself to placenta villi, causing infection, while Plasmodium vivax has a latent phase of infection that primaquine is contraindicated during pregnancy and lactation, so this treatment is not administered during to cover for infection during pregnancy. We are currently using Fancida or sulphadoxine-pyrimethamine as intermittent preventative treatment for malaria. However, studies have shown that malaria has become highly resistant to Fancida. Although Fancida has lost its anti-malaria potency, it still has antimicrobial effects that women taking Fancida during pregnancy still have bigger babies. Our choice of treatment for the intermittent prevention of malaria during pregnancy is the second-line treatment of dihydroartemisinin So combining Fancida with dihydroartemisinin, it may maximize the benefit of preventing malaria infection during pregnancy and improve the birth outcomes. So currently we are doing the SAPOT trial, and it's based in 5 clinical sites in Madang. It's a double-blinded randomized controlled trial, and we are recruiting 1,172 pregnant women. 586 would be under intervention, and the other half would be under control. So far, we screened 2,307 pregnant women. We were able to enroll 1,148. We are nearly done with our recruitment process. 861 have delivered with better outcome. 833 were live births. 816 neonates survived, and 548 have passed their 1 month visits, and we are actively following up until they reach 1 year. On the left, the bar chart showing prevalence of malaria infection at first antenatal enrollment visit at different time point captured by 3 different clinical trials. So the blue bar shows the light microscopy result, and the yellow bar shows the PCR result. Overall, it shows that there is a high number of moms with malaria infection before their first antenatal visits. So on the right is the preliminary PCR report data for SAPOT trial. It shows that at enrollment, more than 40% of women are positive with malaria infection. And then after taking first dose of treatment, it significantly reduced by half to just above 15%, and it continued at 15% until delivery. So when we unblind, we would know whether this 15% that with persistent infection, are they from the control arm intervention or shared among both trial arms. So the SAPOT randomized control trial is testing a new IPTP regimen to see if that could protect pregnant women against malaria infection during pregnancy and improve the adverse pregnancy outcome. It also supports the wider elimination effort to reduce malaria infection transmission, and the findings from SAPOT trial will have all the significant policy implications for practice in PNG and also globally. We would like to thank our funder, our collaborators, participating clinics, our study participants, and the communities. Thank you.